Okay, this is about sickle cell anemia, and then the people that are going to be on the panel. Okay, just a minute, just send me that information now. Sickle cell is something that some of us have experienced. If we have not experienced it, we have people that are close to us that have the disease. It's a medical disease, understand? So that is where we start. It's a medical disease. It can be diagnosed, understand, but the origin of it stems from the parent genotype. Correct. So it's the panel is Salami. She is 24 years old. She's a graduate of modern languages and teaches in a secondary school. She's the Amira of the youth MFAS. She's born with sickle cell anemia. She spends free time going out with friends, holding watching people and reading. Okay, this is going to be a panel discussion. I think the information has been sent out before. It's a panel discussion on sickle cell. I will anchor the event. Then we have on board the sickle cell specialist, Dr. Sharifa Mama. Today we have sickle cell warrior, Salami, another sickle cell warrior parent, Mr. Shalewa Taylor. I hope all of you are on board with us, all those that have mentioned. Okay, in place of Mr. Shalewa, we will have Alaja Raphael. She's here with us as well as parent warrior. So I think we've got everybody on board now. Alhamdulillah. Before the sound is low. Okay. Can you hear me now? I'll have to be is it okay? Can you hear me? Just thumbs up or you are connected. It was online now. Sorry about this. Can you hear me? Thumbs up. I just put on this topic. To prepare a bit better of fluctuating here, this is the internet issue. We have to here. I will proceed now. Can I ask, with a show off, I want to see how many people on the platform understand, let's go the other. How many people do not know what sickle cell disease is? I mean the full-blown disease. I'm not talking about the trait. How many people that, if you don't know, yeah, put your hands up. Somebody has raised their hand. Who can, so let me see who has raised their hand. If you don't know, just unmute and let me know if you don't know what sickle cell anemia is. I'm really, really struggling to admit and talk at the same time, but alhamdulillah, I'm coping. Does anybody not know? Yeah, not now anymore now. About it.
Okay, because that person can do that.
Yeah. Okay, let's just, okay. There's nobody that is, okay, that's good. Every one of us know what it is. Alhamdulillah Rabbil Alameen. I will give a brief
just a brief introduction into what it is. I was researching, still trying to find the origin of this disease because it's predominantly in Africa and the Caribbean, mostly in Africa, but the Caribbean as well. And the question is that why is it this area? And what I was being able to find out is that in the attempt to look for the solution to malaria, understand, part of what they did was to spray the whole of West Africa with some, what I can call medication or whatever, and they believe. Yeah, but they didn't raise their hand, is it? Okay, if anybody wants to talk, I heard that Babs Ajayi, you want to say something quickly? Unmute yourself. Babs Ajayi, unmute yourself.
Yeah, I already did that. So,
yeah, I've told him to go ahead and talk.
AUX mode.
Okay, Babs Ajayi, yeah, go on. The floor is yours.
Okay. Yes, I was going to just quickly add one or two slides to kind of explain away what the issues are, because I think it's important.
Yeah, go on, because we have a panel discussion. I'll just
okay.
Yeah, so
yeah, I felt it's important to just clarify in a simple way that sickle cell is a group of inherited red blood disorder.
Yeah, all that is going to cause that as well.
So we need to know that. So once we know that it's a red blood disorder, and we also needed to kind of have an understanding of what the basic types of blood genotypes are, that people ought to know their blood genotypes in order.
We're going to come
all
that to understand that you presentation already, but we want it to be interactive. We've got a specialist consultant.
Okay, we're going to get into that. All right.
And
so
I could see that you've got a lot to contribute, but don't let us stray away from the panel. Yeah.
All right.
That's the reason why I was asking if there's anybody on board that doesn't know what this is, but it seems everybody on board knows what it is. So we're just going to educate ourselves more now. Okay.
All right. Thank you.
Thanks for the effort. Yeah. Thanks for the. I could see you've got a lovely presentation up there. Maybe you can even share that with us later. Yeah.
I will. Okay. Thank you.
Okay. Can we start with this? I've got a set of questions. Understand? So, what is sickle cell anemia? And I will ask Farida Salami, somebody that is experiencing it from birth up to now. So Farida, can you tell us, understand what it is? Yeah, unmute yourself. Oh, you're not logged on. You have to come. Okay, Dr. Sharifa, while we try and get Farida ready, can you tell us what it is, Dr. Sharifa? Unmute yourself. Dr. Sharifa online. So, yeah, Dr. Bismillah. Go on. Wa alaikum assalam wa rahmatullahi wa barakatuh. We can hear you loud and clear.
Yeah, I might be able to share the screen, please, quickly.
Yeah, go on. You can share it. Are you able to share it?
Yeah, I'm trying to. Apologies. I really made so much effort to be with you there at the program, but I couldn't get anyone to do my work today. I'm currently at work.
Okay. But are you okay doing this now?
Yeah, it's okay. Yeah.
Are you struggling to?
No, I will share. No.
Okay. I just want to make sure it's nothing to do with us here. And while the doctor is trying to share
Sorry,
screen,
can you see my screen, please?
and that's fine. Okay. What do you want to tell us? Wow, 1910.
No, so this is not for, don't worry. So yes, I'm just,
You want to make it bigger?
yes, I'm trying to, yeah.
Okay, there you go.
Yeah, so this has been described. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Thank you. Yeah, thank you for inviting me to this discussion. So I'm a pediatrician, but I think whatever I say about sickle cell disease is applicable to every age group. Yes, but we see children with sickle cell disease right from when they are just delivered. So whatever, the way we manage them at that time also determines the type of adults they will be. So it's very crucial to pick the children up at a very early age so that we can start all the preventive measures that are available. But just quickly, I'll talk about, just to mention about the history, that it's been with us for a long time. And it was first explained by this gentleman, a cardiologist. And of course, subsequently, there was nothing much at that time after that identification of sickle cell disease. And in 1922, a medical patient at Johns Hopkins Hospital also first named the disease. And so there was things were evolving. And still till today, imagine how many years after, I don't think there has been as much progress with our management of sickle cell disease. Of course, I can't complain because yes, there has been a huge change and lots of changes are continuing to happen because of increased awareness of what sickle cell disease is all about, especially in the last 10 years. I think what has happened in the last 10 to 20 years is more than what has happened, can you believe it, from 1910 up to the last 10 to 20 years.
Yes.
So sickle cell is just this, you know, because of the shape of that blood cells. This is the normal blood cell, and this is the sickled blood cells. So it got the name from what happens to the red blood cell. And why do they sickle? I think the reason is actually further down. I think due to stresses, so red blood cells containing sickled, red blood cells will become sickled in conditions of reduced oxygen. When there are stresses, then they become sickled and they do not flow well through blood vessels, especially the small vessels, capillaries, and they are more adherent to that vascular endothelium. So the normal red blood cells, the way they are made is so that they can go past through small vessels easily, they maneuver through very easily. Yeah. But when the shape changes, it reduces the ability to do that. And this change in the shape is changing to sickled shape, makes it so difficult to pass through the vessels and can be causing excruciating pain. So because of this difficulty passing through the vessels easily, there will be occlusion, and there may be what we call crisis, which is the painful crisis. So there are other things that happen as well. It's not just change in the blood vessel. There are other things that happen. There will be, so endothelium is the inner lining of the blood vessel. So there are also other changes happening, and other things are happening in other blood cells, like we call the platelets. So there are it's a combination of things, but the common thing that we all know is that the cell shape, the change in the red blood cells, changing to sickle and making it, causing a traffic jam. So what happens is, because the blood cells are not moving very easily, there will be like a jam. So there will be slower rates of movement of the red cells. so that more are coming and they are trapping, clogging, occluding the blood vessel. And this can be a very painful process. So I think that is what was in this previous slide.
Okay.
So this is it. So normal blood cells will move through the vessels easily, but when they are sickled, it slows down the flow and see what happens. And this can be very painful.
All right.
Yeah, this is another explanation. So should I wait for the next question?
So now in our, that's this medical explanation of what it is. It's just like a block drainage. And I always use the example of, pins and needles. That's the closest you can use to describe why it's very, very painful. And what I've realized, those specialists on board, I realized this years ago when we went to my father-in-law's consultant in Cromwell Hospital. He's well known in this country. He's also a specialist in sickle cell. For me as a person, I'm a realistic person. When something happens, and that's why I'm using my daughter, I'm surprised that a lot of people don't even know my daughter is sickle cell, because right from birth, we've been investigating the best way to manage the situation, share experience with people. There's no need of hiding this issue. It's a medical disease, understand, condition. Just like now, mental health, people are coming out with it. It's not, it can be managed, understand, just like any medical. They have what you should refrain from, when you should refrain from it. But what I really just wanted to point out, that you would be wondering, there's a spectrum, understand, because I ask myself, why is it that some people have it so bad, it affects their quality of life? Some people are on the other extreme, understand, it doesn't really affect their quality of life. So medically, he told me that there's a spectrum, understand, and all this, it depends on your own lineage, understand. So maybe the specialist can talk more on that. But now, when she was telling you about the pain, understand, that they go through, only somebody that's going through that pain can tell us. And I've known in the community, I know young children that have sickle cell, I know teenagers that have sickle cell, I know those that are in their 20s that have sickle cell, I know those that are in over 50 that have sickle cell, I know those that have got sickle cell that have kids, both male and female, understand, they're looking after their children. So it's around us, understand, because now people are able to manage it, and probably in this environment, understand, the medical care is. But I would like, Farida, would you like to explain to us the nature of the pain? How long does it last for? What do you do to manage it? Because our reason is that when we first had Farida, what was on our mind was that would she be able to finish education? Would she be always absent in school, miss out? But because we learn on how to manage it, Farida had never missed an exam, right from reception up to university, based on a sickle cell condition. She's done all the sports there is to do, understand? But the pain is there, and then how she manages it, understand? Let her tell us, number one, what the pain is like and how you manage it.
Can you hear me? Sorry. So yeah, like my dad said, I have sickle cell anemia. I've had it since I was born. And yeah, I think obviously I would be the best person to talk about what the pain is like. So as Doctor mentioned, sickle cell crisis comes from when the cells block the veins, which I think just the sound of it sounds quite painful as well. Like to have your oxygen or blood flow reduced because of a blockage is going to be quite painful. For me, it's just quite sharp pains. That's the easiest way I can use to describe it. They're sharp pains that I experience daily, and they normally last they can last for like the whole day, really. They can last for a couple of hours. It's more in terms of the intensity. And speaking on that, I remember actually when I had a doctor's appointment and they asked me how often I get sickle pain, just in a checkup, like how often am I getting my sickle pain? And I was there with my mum and I said that, oh, I get sickle pain every day. And I remember she was quite shocked and she was like, every day, like, are you sure? How can you have it every day? Now, doesn't that make you, like, if you had it every day, wouldn't that make you weaker? But I think living with something that happens daily, you become quite resilient and accustomed to what it feels like. Alhamdulillah, I'm not someone who gets extreme pain to the extent where I go to hospital quite often or have to be treated with medication that I can really receive in hospital. But I would say that, yeah, it's not expected, or it's, I guess, maybe not spoken about how often someone with sickle cell is in pain. And for me, that is daily. I have crisis in my limbs, mostly in my arms or my legs. It's definitely something I would say is bearable. Like I said, if you've been living with something for your whole life, you kind of become accustomed to what that feels like. It's quite hard to describe. Like I said, the closest thing I can say is that it feels like sharp pains. I have another sickle friend who she says, feels like very bad pins and needles, sort of how my dad described earlier on. But yeah, alhamdulillah, it's just something that I become accustomed to. Take my medication to help me reduce the pain, I guess.
Okay, when you're having the pain, what do you tend to do to relieve you of the pain?
So for me, my last resort is always to take medication. So I don't know if, obviously, maybe medical people would know the sort of medication, but I would take dihydrocodeine or codeine. Those are like the last resort before going to hospital if it's needed. But I would also say I've built quite a big resilience or tolerance to the extent that I try not to take that much pain medication. I'd rather bear the pain than take the medication and become reliant on that, which I think in my case would then make me more resistant to that medication, and I'd end up in hospital more often than not. So I then also use home treatments such as like heat lotion, trying to make sure I stay warm. That's a big thing for me, trying to make sure that I'm not cold, and hot water bottles and massages. So one key indicator for me, and people close to me or around me will notice, is that if I'm in pain, I'm normally massaging that area, which is something that really helps me sort of bear it, I guess. Okay,
so that is from the person that really feels the pain, and how she describe it for us. We are always saying, oh, look, I know my daughter, so when I see, she knows that when I look at her and I know that maybe she's going through pain, I could tell, and I would tell her, like, you're having crisis, and probably sometimes you tell her, no, it's okay. Understand? So this I did, you can pick up the signs. Understand? But if I may ask again, Farida, so in terms of hospitalization, when is it? At what point do you think, oh no, I can't hold it anymore, I need to go to the hospital?
Like I said before, alhamdulillah, I don't go to hospital often for crisis. I think the most unbearable crisis for me is in my chest, because it's painful but also affects my breathing. So I think that is, for me, that's the one that I don't play around with. Once I get crisis in my chest, it's normally straight to hospital, especially because obviously of the breathing situation. And infection, which is another one. So if I've got an infection, that obviously leads to higher amounts of crisis pain, and then my tolerance isn't as great for that as well. So those are the two main points where I would, have to go to hospital. I mean, it's not a very nice experience. So my parents or my siblings or those around me will tell you that I'm very resistant to going to the hospital. So like I said, I will bear the pain till the point where I genuinely cannot tolerate it anymore. And yeah, they're kind of like dragging me to the hospital.
Okay, as Alaja is with us now. She is a parent warrior, yeah, sickle cell warrior. So she can give us her own view of somebody that understand. I'm a parent as well, but let's hear from Alaja. Understand our experience of what it is to take care of somebody that has sickle cell. Bismillah, Alaja.
Assalamu alaikum wa rahmatullahi wa barakatuh. Yeah. This is a biggie. It's a biggie. I've been with the warriors for the past 40 years. So I don't even know how to explain it. Because the pain is not for the children alone. It includes the parents. You be in that pain when they are in pain. Sometimes you'll be praying that the pain should come to you and leave them alone. Because the doctor that used to take care of my children when they were little was telling me one day that one lady with sickle cell, she went to deliver. And when she came back, she said, oh, this having a baby is just 1/1000 pain. But sickle cell pain is like 1,000 times. You can know those people who have children that deliver their babies. So it's a lot of pain. And we are always having sleepless nights.
Okay, I could see that Alaja getting emotional. Yeah, I could see Alaja is getting emotional about it. So this is why we want to really bring this home. Understand, you don't need to, alienate somebody that's got sickle cell. You need to know how to help them deal with it as well. So we need to support ourselves. There is progression, like Doctor said, in terms of there is a cure, but it's very risky. Understand? There is, and I've seen 1 or 2 people that have been cured of the disease, but they wouldn't even let you go near the cure unless it's really affecting your quality of life. Understand? So advancement, I read about it. There's so many things coming up now. They've even identified the gene that caused the sickle. Understand? The next stage is how to correct that gene now. I'm following a lot of, there's another thing with the expert will tell you, when they're young, hardly did they go through crisis. And I was told because it's because of the fetal hemoglobin, understand, which prevents the sickling of the red blood. But after, subhanAllah, look at the way Allah, after a certain age, then the production of that F-type hemoglobin stops. And one of the research they're doing now is how to trigger it back on now, understand? So that's in the pipeline. So there's other research whereby they just do a full stem transplant. Even Farida's consultants were telling me that, look, NHS now funds it if the, the stem cell is from a sibling, understand? There was, yeah, so you could see that there is light at the end of the tunnel, understand, in terms of the progress. And then they've got drugs now, which is the one yeah, you can see that, yeah, they've got that, they'll be using that a lot in America. NHS now has taken that on board. There's one now that came out a few months ago, and I know somebody that is sickle that has taken it and said, look, it's brilliant, but you have to be injected with it once a month. So now the question, we've talked about how people feel about it. It's not an easy situation to be. But you ask yourself, why do you bring such children into life? Understand? That is a very big question. The parents, I don't feel guilty about it. I always ask my daughter, would you have chosen anything different? And she would tell you no. Understand? She said, it was a conscious decision for me and my wife. Understand? In the sense that I remember that when we met, the first thing we asked ourselves was our genotype.
Wow.
She wasn't
Why
like,
did you marry? Why?
That's
what I want to talk about.
Now, when now when we knew that this was the genotype, you see, the thing is that some people say, you know, you shouldn't marry. That's not the solution to the problem. No. Now what it is that for me and her, I felt that, okay, fine. It's a 25% chance in every in every pregnancy. It's not the number of children you have. If you have a pregnancy, there's a 25% chance that a sickle cell. Now there's technology that could test the fetus for you and tell you whether the child is going to be sickle. And you have at that point, understand? What is no, well, people can say whatever they like about that. But what it is that when the doctor told us that, look, you contaminate the pregnancy. Now I have to now look at my religion. I have to look at what my religion is saying. And I know that, look, life, understand, my wife's father was sickle, understand. That's my wife. She has 4 siblings, understand. None of them are sickle cell, understand. So I have people that are in their 50s that unless they tell you that they have sickle cell, understand. And you have people that have other diseases, understand. Yeah. So I have people that have seen that, you know, they've got 3 children, one that I know very well. So this is not a matter of being selfish. I have 3 children, only one is sickle. It wasn't my doing, understand. My own was on religious basis, that he who creates know best. Understand, that is my level of my gene. And my daughter has told you that, look, even if the situation is to be reversed, she wouldn't want us to change the decision we made. Now, like we said, people have it extremely bad, but the thing is that there is hope for the future. Yeah, I think, yeah.
I just wanted, before you go on, I just wanted to add that what my father said.
Mm-hmm.
My dad had told me that how many children are brought up forth who are not sickle cell and don't reach the age of this before they even pass. How many children suffer other things, which is even much more greater than sickle cell. So he told me, if the life is not in my hands, if that is the way God has chosen for me, I should be strong and go with it. And Allah will guide me. If it's not my way, then it's not my way. In my family, we've got lots of sickle cell in my family, but it's been well controlled. My dad died at 60, and my dad didn't die because of sickle cell. Yeah, my dad died because of kidney failure due to other things. So, you know, when it comes to, it's a very hot issue, but like my husband was saying, there's always the light at the end of the tunnel. And if people like us were not brave enough, or people like my father was not brave enough to go through all these things, the research, where research is today, we need to have got there today. My husband mentioned Dr. Konote Ahulu. Konote Ahulu started research in Ghana. It was in the villages, and there was sickle cell was a big thing in Ghana. And up to today, it came to the UK and did the research. So because of all those researches, that's why we
are they here online?
Yes.
That's
why we are at the point we are here today. So, yeah.
I know, like I said, this is a very sensitive issue. Schools basically will not come together once they've heard it. Fine, understand, like they say, it's all about choice. Some people are not even aware of the genotype before they go into marriage, understand? And until they have their children before they are aware of it. Now there's awareness, understand? By saying that, look, parents are selfish. I have parents that they will tell you that your child you are carrying is going to be suffering from Down syndrome. Then you have to make a decision. Do you want to terminate the pregnancy or not? They are bold people that their children have deformity, that the expert will be saying, look, you need to get, my wife is a midwife, and they will tell you that, look, you need to get rid of this child. And they will tell you that, no, not even on religious basis. They will tell you, no, as long as they're alive, they're managed. So it's a choice, understand, for parents. And alhamdulillah, the research is going on. There are many other diseases, understand, that you can encounter. Yeah, it makes you stronger. It makes you value the creator as well. And then the children, yeah, understand, it's not easy seeing them going through pain, understand? But then there's ways of managing it. There's a question here. Yeah.
Just a contribution, especially on this topic of whether or not couples should marry after identifying the fact that they are carriers. It is important for us to understand that Allah says in the Quran, Allah is not going to give anybody a burden greater than they can bear. Now, personally, I grew up knowing a family down the road on my street where the children had sickle cell. When they have crisis at the time, I was young, this was even pre-university days. I'll go there, I'll be with the children, the parents might not be around, and I can see pains and suffering from them. And I'll just be, advising them to calm them down and all that. On my way back home, I'll be shedding tears. How a child can go through something like this. So for me, it is something I understand that I can't bear to cope with such. And so before marriage, I was one of those who campaigned that you have to check your sickle cell and you have to make your decision whether you want to go ahead or not to go ahead. For me, I believe people who are AA should be marrying AS so that we can minimize the number of sickle cell people we have in society. And at that time, I checked my gender and daughter, and I was told I was AA. So I didn't even mind. I was even determined I was probably going to marry an AS. But unfortunately, when I met my wife, I didn't even think about this at all. So we got married only when we were having our third child in this country that they told me I was AS. Wow. And that was when I realized that, wow, what sort of trauma I could have put myself through, knowing fully well that I really can't cope with a sickle cell child. So the bottom line is this. Like Umar, when he was going for a battle, and they were going to pass through a town that had, what's it called, a plague. And he conveyed his generals and he said, look, we have this situation. We have to pass through this town to get there. Should we or shouldn't we? Those who were eager said, we must continue. Our greater goal is to go and do that jihad. It is greater than the fear that we have. And somebody else said, the Prophet, if you see a town that has a plague, don't go in, and if you are in, don't go out. And Umar said, we're not going to go through, we're going back. And those who wanted the jihad asked him, are you scared? Are you afraid? This is Allah's qadar for you if you get it. And Umar said, I'm going away from one qadar of Allah to another qadar of Allah. So my brother, the choice you made, the choice I made, these are purely based on our qadar. And it is Allah who designs our destiny and who designs what we can cope with and what we cannot cope with. Assalamu alaikum.
Alhamdulillah Rabbil Alameen. I wanted to we're coming to that whereby I've seen few people, even younger ones, that have been told, I don't know how they do it in Nigeria. I understand people among us that have been told that they're AA, and probably a year after when they get into this country, and then they are now find out that they are AS. There's a lot. So you see, when you leave things into the hands of Allah, look at Shamsuddin, who was campaigning that, look, you have to be AA, understand? And it was after about having the third child that he realized that he was AS. Now, if anything happened before, what would you have said? He was being cautious, he thought, understand, he found everything that he needed to find. And then you now realize that if they told him at that point that the child was SS, sickle, he probably would call his wife and say, no, this can't be true. No, this is not my child, because I am AA, and there's no way my child could be sickle cell. And poor woman would say, what are you talking about? He said that, and then they will now do the test and realize that all along you were AS and you thought you were AA. So I've seen a lot, even with our community, I've seen.
No, even then, we gave birth to
okay.
And he did in Nigeria house, you are asked to donate blood before you do maternity. So he did that, and they check for HIV, they check your blood, and they check your genotype. We had 2 kids, and he donated those blood, and those tests were carried out. What I realized is that people just give you the results you want to, or they don't do it. Because in the UK, we had to do that test again 3 times. Different hospitals, and I realized I had been on in Nigeria, I had been on what do you call it? Folic acid, multivitamin, I take it every day. Only for me to realize when I go to the UK that I have I'm a fear of asthma plus thalassemia, and I'm not meant to take these medications at all. So it is where we are coming from. But having said that, because it was so sure, it's a vitamin A, and I'm not looking for it, but you didn't care whether I was SS or not. But what would have happened if you had said, okay, I'm going to go for AA at all costs, AS at all costs? Imagine what would have happened to him now. So,
Alhamdulillah, I think there's somebody online, which is Babs Ajayi. I could see why you came across the way. Understand? May Allah ease your affairs, understand, and ease your daughter's affairs. I think I will read some of, Brother Ajayi's message here. So you can see when I said this thing is a spectrum, and I understand exactly where it was coming from, understand? I understand these are what I mean when I say, like, even in the NHS, they know when it's affecting your quality of life. I have a young girl that is going through the transplant at the moment now, understand, and almost done, understand. So those are the things I'm saying that yes, NET, Oba, renewability. Elijah was emotional, understand, because I know that she's had it bad. Alhamdulillah, I've not had it that bad. So when you see somebody
because
like,
you live in England.
When you see somebody like, no, it is because in Nigeria, but Ajayi is right. In Nigeria, when I'm going to read it. I'm going to say, you see what? When I was in Nigeria, before I even said I was going to get married, I had in my class Sickle Cell. Maybe Allah knew the direction I was. The myth was that these people will not live to 17 years old. That was the myth in Nigeria. I'm telling you, it was strongly believed that anybody that, even then they shifted to 21, it was initially that, look,
they say to your face.
Yeah, they will tell you that by the lifespan is 17 years old. And they will tell you that, and that's it is. So you see, ignorance played a lot, and as a result, these things were not being managed. Understand? It's like some people will tell you So now let me just read what my brother. But are you okay if I read this out?
Absolutely, absolutely.
Okay, now look, you can now see where Brother Ajayi is coming from. I didn't take offense or anything because he said it's better to give birth to a healthy child from inception. It's better to give birth to a healthy child from inception. Science has made it possible for us to know what to avoid. Prevention better than cure, understand? Now, that is good, but level of Iman sometimes is different, understand? Now he now says, because I am one of such parents, I now know that I was selfish as I see my daughter suffer so much pains and I cannot get rid of the pains or share in the pain. That's a parent warrior for you. there's been days where I just sit down there, my head's in my hand, understand? Thinking that what else can be done. Then he says, shedding tears, I'm feeling so bad. My daughter had a leg ulcer for almost a decade, and it was hellish for her. She had to leave school and come to America for skin graft surgery several times. The hardship was heavy. So these are the others. You know, sometimes people go blind. People go blind. Understand? Some people have to have organs failures, understand? So it's what we're dealing with here is, understand, it's a severe medical condition. And when you read things like this, you could understand the pain that Babs Ajayi is going through. And that's why he was eager, understand, to share. In Nigeria, in Ghana, my wife is mostly from Ghana. Ghana has a bit of understanding of it. In Nigeria, because of this myth, that they will even tell you that what do you want to spend? Understand? So in the last 17 years of age. So, but what I'm saying here is that now there's somebody else that says, what do we want to do in terms of a couple? Are we saying we should not get married to somebody? Okay. Before I go on that, brother Kolawole.
Let me quickly say something. Yeah. I mean, like you said, when I was in Nigeria, I had little knowledge of what it's all about. But my brother-in-law has, very, very bad one here. Now, I think, like the doctor said, about 30, 20 something years ago, Niham General had no idea of exactly what it is. And so they would just take him to hospital. I mean, then, hospital almost every 2 weeks. They would go and spend 1 week. Then later, they decided to do blood transfusion every month, just to keep it. So, I mean, because, sometimes we will just sit down and be talking, and suddenly the pain will come. And it was very bad. It was very, when I said bad, it was very bad. And so you look around, you feel bad, you feel that you couldn't do anything to help him. And so you see, it's, I mean, like someone like you said, I've gone through it as well. I've seen him in him, and he took a toll on his wife as well. Because again, initially the wife was advised not to marry him because of it, but she refused. But now, can we say that well, we told you so, and so we couldn't do that? So we had to do everything possible to support both of them and the children. Yeah. So it's it's kind of.
That's why we're discussing this. Okay, but Asmail.
So what I want to just quickly bring up is what we can see is the religious perspective to it. Nobody will tell you that because of your iman is high, that when you know somebody is SS and you are AS, that you want to go and marry them. Yeah, don't do it because of your iman. But today, what we know is that with the advancement and the knowledge, people who are AS should not marry SS, should not marry AS. We should make the effort. If for any reason people, have these conditions and they go on to marry with a choice, at least today, unlike yesterday, somebody doesn't know what it is like. They just say there is sickle cell, but today, a lot of us will know what it entails. And if you want to go to that, you have your reason why you want to go to it. Or the message you want to carry along and spread more is that you should not consciously go on to go and do this. But you know what? If Allah has destined that you are going to go through that way, you would get there. Okay. Like
there's a lot of questions online. So can we make that?
Sorry, can we have?
I want to call on the Dr. Bismillah, and then Sister Fatima.
Yeah, assalamu alaikum.
Dr.
Yeah, thank you. I think there are so many experts here. Actually, I've learned a lot from you all. So Abu Farida, I must commend you. Brother Babs Ajayi. I think you are both great fathers. I'm really impressed about, reading Brother Bab's messages is quite moving. And I was quite emotional as well. because you are great fathers. So I have close to about 400 children under my care. I lead the sickle cell service for children in my hospital. And what I see is different. You know, fathers run away. Fathers run away. So that's why I'm saying well done. Not only when it's sickle cell, any medical condition. I think African fathers, I can say African fathers at times are weak. Not only sickle cell, when there is a chronic, I remember one of my patients that had meningitis, and the child lost all the developmental milestones. A child that was 6 years old, that could talk, that could, that could do everything, suddenly lost all the developmental milestones. You know what happened? During that admission, the father ran away. So, when there are times of a period of hardship, it's not the time to run away. That's the time to support and be fully part of the family and care for the child, because you are both responsible, for taking care of the child. So what we see is different in the hospital. And I think you've mentioned, most of the time, you've mentioned this about having false results from Nigeria. So many people are falling victim of this, where they've checked their genotype in Nigeria and they've been told they are AA, and I see that a lot as well in most of my patients. They tell me they were careful. They thought about it. They asked for genotype before going ahead. But Allah knows best, as we said. But if you're in the UK, as much as possible, you should try to get your genotype done again, even if you were told you were AA. Unfortunately, if you've been told you are AA, that'll be the last thing you remember to do again, because you've been told you are AA, so you will not be thinking, let me check again. So yeah. So another thing I would like to highlight as well is the choice of the couple, of like, if we have two young adults or maybe adults who want to come together, is their decision. Is their decision on what they do, whether after they know they are both carriers, to go ahead or not to go ahead. It's very big issue. At the time when you've not experienced, you don't know what's going to come after. It's very difficult. Like what you mentioned, you see two carriers and none of their children were affected. They knew they were carriers. They went ahead. None of their children were affected. But we can also have two carriers and they can have 4 children with SS. And like you said, it's all spectrum. So I think there are lots of things available to us now. And unfortunately, we are also not the best people. We don't really make use of all these opportunities with us. And the reason is not far-fetched, as you mentioned. Like if you do prenatal diagnosis, there are different types. If you do the one where you are already pregnant and then you test the child, you test for at 12 weeks, at that time it's too late, because an African, we are very religious in Africa. Whether Christian or Muslim, nobody wants to do what comes after. If you now know that a baby is affected, you're not going to take the option you're going to be offered anyway. So nobody can fault that, because we all know that life is very important, especially when we come from very religious backgrounds. But there are also tests you can do before you get pregnant at all. Unfortunately, this is not available until you already have one affected child. This is done before you even get pregnant, where you and your partner you and your husband or wife goes to the specialist clinic, and they choose the embryo. They choose it's quite advanced test, and so that they will choose is pre-implantation test. So before the egg is implanted, it's tested. So that is also available, but there are very strict criteria for one to meet up with this one. You should already have one affected child. You should be less than 40 years old. You should be a non-smoker. So those are all available. So when you see a family here having 4 children with SS, it shouldn't happen, because then you are already entitled with the first child that is affected. So we should be aware that these things exist. Yeah. And but what I can say generally is that a lot of improvements in the management of sickle cell disease. Many of my patients I have are not having frequent crises. They're taking the new management that are available to them in the market. Occasionally, they still come in despite the best treatment, but it's definitely better managed. I think one thing that I wanted to show you quickly why the problem we may be having this problem in Nigeria. So this is what happens when we test. So this is what we call it the electrophoresis, the red cells electrophoresis. This is how they check it. So this is what happens when they test it in the laboratory. So AA will come out like this. And then AS will come out like this. And SS will come out like this on the hemoglobin electrophoresis. So what it does is it arranges these lines are according to the AS. There are other genotypes as well, but the common ones are the AA, SC, SS. We have SD, SE. There are so many. We have big sickle beta thal. So if one is already a sickle cell carrier, and one marries another person that has the beta thalassemia carrier, you can still have a combination that can be severe illness. We call them sickle beta thal. So they can also behave like SS, and they can also be very unwell. So if you are not sure, I think you should also ask for further explanation. So I'm just wondering what is going wrong in Nigeria where they are not reading this properly. Maybe it's not separating properly, and they are not seeing this. If they don't see this bit as S, they may say the person is AA. And so that's a little I'll contribute for now until I have more questions or any need to contribute. Yeah, and just quickly, I'll mention quickly as well, for those people that were not born in the UK, if you were not born in the UK and you have come in at maybe after the first year of life. Usually in the first year, they will still try to do the sickle cell. There's this blood heel prick test they do for every baby that is born in the UK at day 5 to about day 7. The health visitor comes home, or the midwife, and they do heel prick tests. And this should pick sickle cell disease. It's aimed to pick out of 9 diseases. And some of them are the cystic fibrosis, congenital hypothyroidism, and sickle cell disease is one of them. So you should pick it up. But if you are coming when your child is already 2 years old, you should make sure you see your GP to test the child. And just for them to know if they are carriers. So what happens is once the test is done, all the carriers come to us. So we know all the carriers and we know all the affected. So we send information to every family that they have a child that is a carrier. The child will be well. Carriers are well. And that's why, the people having sickle cell disease, children with sickle cell disease now are carriers, because they will be well all their lives. They won't know they are carriers. And unfortunately, one day they may have, because they won't take precaution. So the carriers, we send the carrier card to them so that hopefully one day they'll remember to tell that child. So because I still foresee a problem where families will forget to tell that child, because the child will be well, a carrier child will be well. And one day they are now old enough, they want to get married. If their parents don't remember to tell them, they will not take precaution. So, and those that are affected, immediately we must see them. It's very urgent. We have to see them in the first month of the diagnosis. Within 3 months, we must see them in the clinic, and we have to follow them up. We need to do annual head scan for them when they have SS to pick risk for stroke. And generally, they do very well when they are very compliant with their treatment, and they come for follow-ups, because during the follow-ups, we pick up, preventive medicine is early diagnosis and treatments. So when we already know that someone has a SS or SC, that's early diagnosis. And then we start doing all the things we need to do, encourage them to have their immunizations. And if at any time there's any need to intervene, we are doing this early rather than picking up things late. We do annual eye tests for them, for those on blood transfusions, to pick up early problem in their eyes. We check their urine from a certain age, we need to check their urine every year to prevent renal disease, because sickle cell disease can cause renal problems. They can have renal failure. At a very early age, they may need renal replacement therapy. So to prevent that from happening, we pick these things up earlier and give early intervention to prevent this. So I'll stop for now, because I know there's a lot of contribution and a lot of interest on this topic, to allow other people to talk as well.
Yeah, I think you are right. There is so many contributions. I've never seen our chats, understand. It's so busy. People that can't get through are busy, chatting on. And I'm glad. I'm really, really pleased that we've been able to. I think there will be a lot of other, because you will find out that so many people are involved in this. Elijah wants to talk now, understand?
Salami alaikum.
Sister Fatima, I'm coming to you.
What I'm here for is, it has happened. Are we just going to sit down and see our children suffering? We have to put a stop to it. And how are we going to do it? Because it affects the blacks. We have to push like an agenda, like the LGBT. I think that's what we have to do now. Because this is warrior, this is war. The children are at war with themselves. So we have to be war with them. We have to start looking at how are we going to stop this? Because we can stop it. Like in this country, if you are bitten by a mosquito, you may not have malaria. They did something. This AS, we can stop it because this is what is in my mind. Maybe like this red book, they have to do this genotype as soon as they were born. And they have to put it in class, be teaching children, like the LGBT now teaching the children. We have to be teaching the children this AS something. You must not go with AS. You have to stop. We need to do something. And how are we going to start? We are going to start from home. I mean, if anybody knows the government, they have to do this blood test they are talking about. When a child is born, like we have this BCG, you have to do the genotype too.
Yeah, I think okay.
Did they do it? I never knew about
okay, let me just contrast. What Elijah is saying is very, very important. And like the brother Ajayi is also saying is that, look, you can't eradicate it, but we can reduce it. Like even me now, for my daughter, understand, if anybody comes to her as a suitor, the first thing she wants to know is your genotype. Now she knows that, look, she's not going to blindly go into any relationship whereby she'll bring a sickle cell child. Like many people that are AS are conscious of, it's education. All our sisters that are AS, once they find, you don't get in love before you check.
That's the word.
That is the difficult.
Yes,
no. When you start talking, understand there's no emotion attached yet.
No emotion.
Look, ask for the person's genotype. I was speaking to a brother yesterday, and he was, we're trying to get our children married. He's in Nigeria, and I said, look, what is the genotype of your children? He said, well, I don't even know.
They don't even know.
It was like, so we have a long way to go. But yeah, we are getting there. I told him that, look, go and ask your wife, maybe she will know. He said, he doesn't think so. I have to now educate him what the genotype, but his children mostly will be aware. I just Sister Fatima next. I'm holding her. So what Elijah is saying, understand, as we are trying to avoid people getting involved in that, getting themselves in that situation, yeah, we also think that people that are already involved in what is medical science doing, and then secondly, remember some people are going to get involved innocently. Understand? A lot of Africa, Nigeria, they will get involved innocently. They don't even think about it. Yeah. And some people will even have children that are sickle, and they don't even know that this is the disease they're carrying. Yes. So it's a long way to go. Those that are experiencing it are shouting out now that, look, we shouldn't get involved, but we have to be practical and see how we're going to like the Sickle Cell Society. How many of our people join the Sickle Cell Society? I can tell you that I know that it's the Africans that are less represented in this society, and it is our own disease. So because we are hiding it, we don't want to be seen, and you don't want to understand. It's our disease. We are the one that are not joining the institution that is taking care of this thing. Alima, just a minute. Sister Fatima, please go ahead. Bismillah.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Jazakumullah khairan to everyone who has spoken. It's like I don't even know if I have anything more to say. But I just felt I needed to say something because I've lived with it all my life, because I have a warrior sibling. And yeah, so I came into this world knowing one of the first things I knew, even from being a toddler, and I'm not kidding you, is AS. Because of the many visits to Luth in those days, and I remember my finger being pricked and all of that. And I would tell you that it informed my decision to go into medical practice, whatever it was. And just because I lived with my sister and watching, you know, but it grows you in various ways. So the point of the matter is this. From my own personal experience, I know that moving on, there are certain things in life you cannot prevent. That's number one. Heart out to everyone who Allah has chosen to test this way. But we need to understand that, yes, there would be false negatives. There would be things that would come up when you least expect. I mean, there's so many ramifications to this that I have experienced personally. Those who have refused to marry ASs and then realize later on that they're carrying an SC child because the spouse they married was AC. You know, there's just so many permutations to this. But where I want to come in is what we cannot prevent, you know, we deal with. As my daughter has said, as my sister lives with, one thing I want us to focus on from my point of view is the survival, because we cannot always avoid things, so that when it happens, because if we are focusing on the avoiding or prevention, which is important and valid, we should look at this from a holistic perspective, you know, that let's come to the understanding, which has come up in the conversation as well, that let us be very savvy and aware, so that this thing, when it comes, if it comes, as Allah decides, we do not lose sight of the benefits there are and the ways of how do I say it now? Preserving life and giving them a better lease of life. One thing I know that is key, like for Baba Farida and Mama Farida, that chose, Allah chose you for a purpose, and may Allah continue to reward you and preserve our child and all of such. The people involved is key. May Allah bless my mom. There's no time of day my mother cannot go to the Araba. You know, it's not for the faint-hearted, but Allah knows that there are people who would, you know, champion this cause, because as Yorubas will say, I'm not saying that we should be careless or whatever. So that is one. But one thing I also want to know, my sister, you know, is in the latter part of her 50s, alhamdulillah. I mean, I called her, but she's just not, you know, in the space to speak. But if I can speak for her, watching her develop till now, the education in terms of lifestyle matters, just like it matters for all of us. So if parents are not savvy, if people around are not savvy, and you want to treat that child, you know, with your own lack of awareness, you probably would be doing the child less benefit.
So much so, want to contribute.
Yeah. So my take is that we need to all come together and be open-minded and aware, being aware of the options that are available, so that we can support ourselves and others should, you know, this become our reality, and to also begin to look at lifestyle and
okay,
for all
thank
of
you.
us and for them in particular.
That's for time. Sister Khadija, is she still on?
Sorry, can I quickly speak? On survival, there's something extremely important that we need to do. That's blood donation.
Okay.
The NHS needs 140,000 people, and we currently have about 20,000
Wow.
to keep donating blood every day. So there's a challenge that they are trying to get enough people. Yes, so you need to get yourself tested. There's a website.
No, once you give the blood, they will screen it.
Website, they'll screen it, they'll know whether you're qualified or not, or you yourself will know. I just want to add that because that's extremely important.
No, you're absolutely true. I think when did you do? Farida did a campaign about 3-4 months ago on blood donation. She invited almost 20 people to go and donate blood. But one thing we realize is that, we need to also look at what we're taking. Almost 75 of the people that went couldn't donate blood. Understand? Some, they just couldn't get the blood out. Understand? We blacks don't donate blood. Understand that? And then I donated. Then when they screened it, they realized there was still traces of malaria. And as a result, I can't donate blood. Understand? So, but we should all engage, like you said, because look, if a sickle cell patient goes into the hospital, the next thing they're doing is to blood transfusion. You understand? And it is other people that are donating their blood. So that is a very good, thanks for the reminder, my sister. I want Sister Khadija to speak because she had her hands up. Please unmute yourself, Sister Khadija. Yeah, just make it short, please, because it's almost time for Zohar here. Bismillah, unmute yourself. Sister Khadija. Jubril. Okay, yeah, you are still mute. You are mute. Can you unmute yourself? I don't think I can do it. Okay, go on. Okay, while we're waiting, Alima, quickly. She's not responding. Yeah.
Okay, the point I wanted to make was a lot of people have the opinion that AS shouldn't marry AS because if you guys don't get married, you'll avoid your child having sickle cell. I just want to make a point. Sickle cell is one of hundreds of genetic diseases. One. If I ask everyone here now, do you know if you have the genes for Prader-Willi syndrome? No. One watergram is the factor. No, you don't know. Sickle cell is one genetic disease. All of us here have millions and millions of genes. Millions. So many.
Assalamu alaikum warahmatullahi wabarakatuh.
Yeah, we are coming, my sister. Just give us a second, yeah?
Okay. Just because sickle cell is something we're talking about now, we're aware of now, it's just one of hundreds of genetic diseases. By not marrying,
Yes. Yeah.
Okay. By not marrying someone.
Come to it quick, because we're running out of time.
Okay, sorry, I'll start again. So I was just saying that that sickle cell is one of hundreds of genetic diseases, and I was asking the room that, for example, Prader-Willi syndrome is another genetic disease, which I'm sure most of us, if not all of us, don't know if we're carriers of that syndrome. If we go around with this attitude of, I'm not going to marry an AS because I'm AS, if we did that for every single genetic disease, we would never have children. The population would die out. It's diseases and genetic issues is a mankind problem. It's something that we've been told by our Lord that we're going to be tested with. You can't avoid it. If you try and avoid the sickle cell, you're going to end up with something else. At the end of the day, I don't think that prevents the problem because, like I said, you could have the genes for another syndrome you just don't know about, and you don't marry the person you want to marry because they're AS. You marry someone else, and your child ends up with Down syndrome. Like that hasn't avoided the problem. If anything, you should take the steps you can. Make a lot of dua about it. If you want to marry someone who's AS and you're concerned, make dua about it. If that's not written in your fitrah, it won't happen. And if it is, it will. And I think we just need to go back to the point that whatever's written for yourself or the person you're going to marry is going to happen no matter what you do about it. But I don't think not marrying AS solves the issue because there are hundreds of, like, if you go on Google now, there are hundreds of genetic diseases.
Okay.
So yeah.
Okay, my sister, okay, Sister Khadija, Bismillah. Sister Khadija, go on.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum salam wa rahmatullah. Can you just tell us your background?
Hello?
Okay, go on. Hello, go on. We're hearing you.
Okay, my name is Khadija.
Continue.
My name is Khadija Jubril. I'm a sickle cell warrior. You know, nobody should allow two carriers to get married to each other. Listen, forget about him on. There is a lot attached to this. Like a month ago, let me briefly tell you this. A month ago, I called one of the patients in the hospital. We met I was on admission and I met her.
Sister,
so I called her to find out how she's doing.
Hello? Sister, calling Adhan. Just give us a couple of minutes. They are calling Adhan. Yeah, just give us a few minutes.
أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
Alhamdulillah, my sister, can you continue now?
Okay. Like a month ago, I called one of the patients in the hospital. I met them when I was on admission. So I just want to find out how they are doing. And at a point, she got to a point when I said, just continue to pray. Don't worry, everything will be fine. He said, you know what? She replied me and said, pray to who? How can God watch her? All her life, she has been in pain. She has not enjoyed she has never enjoyed a day of peace in her life. Listen, this thing called sickle cell is a lot. Forget about sickle cell crisis. What if the patient is fortunate to have some of the one or two of the complications? Hello?
Hello, yeah, go on.
Sorry, somebody is on the phone. Okay, what if the patient is unlucky to have one of the complications? You know, it's not only about the pains, it comes with a lot of garbage. Emotionally, it's not easy. You understand? It's not easy. It's like testing your Lord. When you know something, you know you can avoid it. Why can't you avoid it? So forget about him on at a point. It's not easy. I'm telling you the truth. It's not easy.
If we got it,
So,
just that
I
have to everybody is short. Thanks very much. Farida, is any other direction you want us to go? Okay. I think are people ready to come back after Zur? Because there's so much going on here. I know that's. Do you want us to come back after Zur to continue for about?
Yes, please. Yes.
Okay. What we will do now, I will continue to about going for Zur here, and then we'll come back. Okay. So now we continue with oh my God. I've got Dr. Balogun Amir. You got your hands up. Can you make it brief?
Yes, very quickly, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. First and foremost, thank you very much all for the very entertaining discussion and very enlightening as well. Very quickly, again, you know, for me as well, it's something I've experienced because the only girl in my family, Unfortunately, she had it and she died very young. So from a very young age, this is something I've been exposed to. It just so happened that some of us, the rest of us, happen to be AE. So in essence, I can, to a very large extent, I can relate to many of the discussions. So the only thing I just wanted to quickly point on is that, we mentioned something, and we as Africans or people of African origin, I think we need to pay closer attention to some of these conditions. I don't want us to have just have this discussion and then go back and as if nothing had happened. There are people working very hard. If it is to join one of these organizations that can help advocate for, for ways to minimize the impact of some of these issues. And I'll touch on one very quick point that Dr. Jewi mentioned. I'm glad that you mentioned that option for that genetic testing, pre-implantation genetic testing. Now, the only issue I have with the approach of the NHS is, why do you need to have a failure first? Why do you need to have someone have a child that has that condition first before they now agree to say, oh, we're going to offer you this condition? I can assure you, if this was a white issue, if this was something that was predominantly affecting the white population, from the very moment they know about it and you plan to have a child, they would offer you that option straight away. So if it is, I think it is something that we ourselves could even start a campaign about. Why do you have to wait for you to have one sickle cell child before you now agree to offer the person an option to be able to, prevent it from actually happening? This is something that has been around for some time, and I do believe that we need to speak up as Blacks and as people of color as well, because the company I work for as well, again, a pharmaceutical company, we told them that, look, some of these conditions that you're actually interested in treating, you're only interested in treating conditions that affect predominantly white people. Yeah. And we need to be able to speak up. We had a meeting with the senior management. I said, look, you need to do more. Yes, you may not make a lot of money, you may not make a lot of bets. We need to do more in terms of advocating for ourselves. And nobody's going to do the advocacy for ourselves until we begin to do it ourselves. So those are the only things I just wanted to mention. I know there's a lot to talk about, but in the interest of time, I'll just keep it short at that.
To move on to now, I think I will just summarize. We've talked about the fact that, we need to prevent this coming together of couples that can lead to sickle cell children. And so we all are aware of that look, that is one way. And then further down, even if you come together, there are other preventions that can be put in place. Understand, like they told you, the test, although there's condition attached, but this is where NHS is going. Indirectly, what I can see straight away is forcing you to go for private in the sense. So don't say because you have to have one sickle child before you can do the test. No, please. This is where private health matters. And private health is not only about afford it, understand private health matters as well. And if you can't, a lot of people, even I know people that their workplace give them medical insurance, but they don't use it. They still end up at NHS, understand? So what's the point of all this medical insurance being given to you? So now we want to move away from, marriage, understand? We all know the right thing to do. We've talked, check your genotype, understand if Allah gives you the wisdom to say, look, okay, fine, I don't think I want to go into this because of the risk. I'm not ready to take the risk, fine. But know that if unfortunately, after all those prevention, it still happens, it needs to be managed. What are the things? And so rather than talking about those things that will prevent, how do we help those that are already suffering from it? Can they manage it? What do they need to do? What is the do's and don'ts? Because I know that a lot of people joined the forum this morning because either they directly know somebody that is a sufferer, or they have somebody that knows somebody that is a sufferer. So this piece of information will go a long way to help. And when we have people here that are, that are directly sickle cell warrior, wouldn't it be best for us to share that information as to what, number one, I will start from what are the what triggers it for you? You know yourself, understand? Maybe people online. Farida, could you help us? What are your own trigger signs, indicators that hang on a crisis is coming? What do you feel? Do you want to discuss that?
Yeah.
Okay, Bismillah.
For me personally, I think for everyone, every sickle cell person, it might be different. I think also I just want to clarify that crisis is one of the main symptoms of sickle cell. There's a lot to it that's not just crisis. Like you can have fatigue, that's something that I suffer from a lot. So obviously sickle cell anemia means you have low iron because of, and then obviously, you know, the lack of oxygen in your red blood cells anyway. So fatigue is a big symptom of sickle cell. So is jaundice. A lot of sickle cell people suffer from jaundice. I suffered from it when I was younger. I don't suffer from it as much anymore. Another one is pica. So you may or may not know that some sickle cell people have this thing called pica, which is where you eat non-edible, you consume non-edible things. So that's something that sickle cell people suffer with as well. Obviously, and doctor also mentioned the risk. Oh yeah, so it's sponge, stones, sand, foil, tissue, like anything non-edible really. And normally, because I used to have it as well, something that I spoke to my doctor about, I think, especially as you get older and it becomes a bit more embarrassing, trying to understand why, obviously, you know, if you're eating sponge or you're eating foil or tissue, like why am I eating this thing? Or sand. And sometimes it could be the lack of magnesium, the lack of iron, lack of zinc. And so these non-edible things have them inside it. And as weird as it sounds, that's what you use to sort of build on that. So for me, like I could smell sponge anywhere that I went and I'd just be attracted to it. I know of another sickle cell person who foil was their thing that they ate. So anywhere that there was foil, they were like drawn to it and they wanted to eat it as well. There are obviously other things that you suffer with as well when it comes to sickle cell. But I just wanted to clarify that crisis isn't the only thing that we go through. It's a very prominent thing. Like I said, I get crisis every day, so obviously it's something to talk about. In terms of managing it, what was the question?
Yeah, you said what are the triggers? Yeah, what are the triggers that you know that occur?
So for me, anything that would trigger my sickle symptoms, like Doctor mentioned, the first one is stress. Any form of stress really can cause sickle crisis. Can also cause you to be more fatigued than usual. The cold is a big one. So cold weather, just being cold in general, you're not wrapping up properly. Dehydration. Getting there. Dehydration, like what we said. So obviously we need to be drinking a lot of water, consuming a lot of fluids, and not doing that again can lead to. Can you hear me online? Yeah, can lead to sickle crisis as well. Obviously, reduction in fatigue. Again, for me, you would notice that I'm dehydrated because my eyes get yellow. So those are things that trigger it as well. Overexertion, and I think that one is it's on a spectrum as well. Overexertion could be literally just doing your day-to-day in the house. So for some people, once you have done literally waking up, got dressed, cleaned, that is it for you. And that's as much as you can do for that day. Others could be, some people can, you know, take part in sports and they can do a lot more. However, that overexertion then triggers sickle crisis or fatigue or anything like that. It's definitely a day-to-day thing, something you have to measure. Some days will be weaker than others and some days more painful than others. But those, I would say, are the main things that will trigger any sickle symptoms. Also overheating as well. I think that's one that you wouldn't expect because you say if you're too cold, but the same way if you're too hot as well, that can also just as equally trigger crisis and fatigue. Yeah, it's a very day-to-day issue, something that you are battling with every single, I'd say, hour of every day. And it fluctuates a lot. So yeah, I would say like you just have to manage your day.
Alhamdulillah.
Oh yeah, I said that before though. In fact, I said that before at the beginning. But yeah, infection, obviously that goes without saying. And you're more susceptible to infections anyway. So you need to just make sure that you're not putting yourself in a position where you can catch infection easily.
Yeah, and no doubt, because you don't know how the food is prepared. Try to avoid, things like that can give you infection. And then one thing that when I was coming, so that is I was thinking that we need to also know is that the kind of medication as well. I know that for Farida, I think for this part of the world, they recommend penicillin regularly, which is to prevent infection, understand? So like you're constantly on that. But they do say that if you're sensing crisis coming or infection, start using it. Some people use it every day, but you don't have to use it every day. So those are the side effect. I don't think there's any medication without side effect, but the side effects are not that apparent. I don't think any.
Sickle cell has a lot of side effects, so you don't know whether it's your blood because it's blood or the medication. There are obvious medication side effects, but in sickle cell you have side effects.
Yes. So now, before I'm going to call doctor now. So that is, so if you know anybody, understand that you can help. Those are the kind of things that I look at my daughter sometimes and I smile and she smiles. I say, you need to drink water. That's my favorite. I'll say, you need to drink water. And I said, no, you need to drink water. You see, once you are in it, sometimes I would look at her and I say, look, you are pushing it, you're getting tired. Understand? So because you don't want to lead to a situation, you don't want, no parents want that. So you need to try and prevent it, understand? Like a lot of my wife deal with forever products. Even when Farida is asking for forever products, the anger, yes, understand, she's feeling something because it's like you have to force her, take your IG, take your jelly, understand? And all these things does help as well. And I think if people come out of their shell and talk about it freely, there's a lot we can share among ourselves. There's so much we can share rather than, was it, when Farida was talking about the issue of the foam, wallahi, we never knew it was related to sickle cell. I screamed on her, I shout on her that how embarrassing it is. Farida, if there's foam inside this thing, as I'm knocking it, Farida will know there's foam. And I was, how do you know? On the foot, shoes, the heel of shoes, she would peel it off. When I hear my wife scream, Farida, oh, that look, she's discovered some foam. So now, saying it that we didn't know it was relating to the sickle cell. I even put it on the internet out there that look, where in the world have you seen somebody? And the response kept coming back. That's when I knew that some people eat sand. Yes. You can understand. I'm that kind of a person that look, let me throw it out there. Understand? And then when the response that came back, I was like, oh my God, what are we dealing with here? Yeah. Understand? So don't hide any of these things. Understand? And then that's when I knew sand. Then all of a sudden, people now, sand my lot of water, sandy. And I knew, and so this is.
And that was due to the lack of.
And it's a lack of something substance in them, and they find it in that. Like she said, when it's now becoming embarrassing, they try to take control. Understand? At a point in time, I had to go and buy a big foam. I said, okay, You understand?
Because you are there.
No, sometimes when you're addicted to something, you think that when you see so much of it, I'm only telling you that I will try to deal with this. And so I will, doctor. Please.
Sorry, that was after we went to Ghana and I told you we saw so many
forms in the market.
Yeah,
So,
assalamu alaikum.
Wa alaikum salam.
Yeah, Jazakallah khairan. For all the expert contributions, learned a lot again. I want to quickly talk about the prenatal implantation. I don't want us to just see it as it's because it's not affecting the whites. So the waiting list for that is very high, and it's not only available for sickle cell, it's available for so many other conditions as well. So, and sickle cell disease, if you are not aware, 1 in 4 Nigerians are carriers. So that's a magnitude of how many people they are going to screen, or how many people that will have to go through pre-implantation test. Because if 1 in 4 are carriers, that's massive. That's 25% of the population. So you can imagine how many Nigerians will have to go through that. And there are other medical conditions as well. So for them saying that there must already be an affected child means that, like, for instance, someone that has 4 children and the first had AA, 2 carriers AS, now having 4 children with first 3 children AS, or first 3 children AA, and the last one SS. So that means they would have tested every pregnancy. You understand what I mean? Because if you're saying it has to be even before the first baby, that means they will test the first one that is going to be AA anyway. They will test, it's going to be the cost will just be, it's not enough, it's unaffordable for the NHS. I believe that's why it's so difficult to access, and they had to put strict criteria. And in terms of the treatment for sickle cell disease, I'll just touch a little bit about it. The penicillin is to prevent, I'll just share my screen quickly and show you why penicillin. And do you see this?
Yeah, we can see.
Okay. So quickly, I'll just show you why penicillin. This is a Sickle Cell Act. This was, there's been a lot of advancements in management of sickle cell disease in the United States before it came to the UK. I think we are following after their footsteps. So look at how it was. This was how it was, how bad it was in the 1910s. Remember when it was first described? Then it was getting slowly better. What made the most significant first change to sickle cell disease was penicillin in the 1980s. So before the introduction of penicillin, lots of children that were affected that died in infancy was actually from infection. And that infection was pneumococcal sepsis. And that is what penicillin mainly prevents. And since then, we have not been seeing that in the UK. Like here in the UK, for instance, you rarely see these things happen anymore if they are compliant with their penicillin. So the other thing that's happened in the UK, not only giving penicillin, is also giving extra doses of immunization, which is for pneumococcal vaccine. So every 5 years, children get pneumococcal extra doses of immunizations with pneumococcal vaccines. Very rarely, like out of my 400 patients, maybe 2 or 3 refuse to go on this preventive medicine. They think they can go through the risk. But the risk is too massive to go through, because we still see pneumococcal sepsis, severe sepsis, even in those that are using the prophylaxis, penicillin. And that's why we now use the pneumococcal immunization as well to reinforce that. And this is evidence-based. Before penicillin was introduced, there were lots of pneumococcal sepsis even in the UK. So I'll just mention that. And then quickly, I wanted to show you the other complications we're talking about. I'll show you this one. Just 1 minute, please. Hello? Yes. Yeah, yes, I'll come there shortly. Give me 5 minutes. Yeah, thank you. Hello, so can you still see my slide?
Yeah.
Yes, so just quickly, the other problems, the other things that we are preventing to be affected from head to toe, any part of the body can be affected. If you look at it, eyes, the stroke is not common in children generally. So when you see a child have a stroke, it's not common, but children that have sickle cell disease can have a stroke. But we prevent all this. There are preventive measures. And that's why they have annual cranial ultrasound scan in the UK. So it measures the velocities of the blood flow to the brain. And that velocity, when it's high, it's like a tap. You know, when you have a brand new tap, the water is flowing nicely. And when with time, deposits in the tap, rusts and other deposits, calcium deposit, the flow is going to reduce. And so what happens in the brain is the blood supply to the brain can be affected as well because of the sickle cell. So it's going to clog into those vessels and reduce blood supply. So if it's severe, it can cause a stroke in children. Adults can have stroke as well, but the risk of stroke is highest between the ages 2 to 16 years old. So in that age group, they have annual cranial ultrasound scan. And when we pick high velocities, it's telling us there's a high risk for stroke. And so we do interventions to prevent that. And look at, it can affect the lungs, they can have chest syndrome, it can have kidney problems, kidney failure, the bones, the gallbladder, they can have priapism. And this one is actually something from even very young age. They can have it from 10 years old, 12 years, about more in that age group, in the young adolescent. And they're ashamed to talk about this because what do they say is wrong with them when they go to the hospital? Because this is what they have, painful erection. And they don't know what to say to their doctor. So, but we tell them all this in the clinic because if it's not managed, then it can cause problems for them in future. So when sickle cell disease is not well managed, it can cause problems. But when it's well managed, if you see some of the patients we have, we cannot tell. Everything is just perfect because they are managing their condition appropriately. So, and something else I also wanted to mention is about the use of other medications like folic acid. So we're talking about the anemia, the pica. So when they are eating non-food, we have a few patients like that will eat foam. I have a child that ate almost the whole of a large chunk of the cardigan was eaten, foam. They eat their hair, and some have even had obstructive because of eating hair. They pluck the hair and eat it, and they've had intestinal obstruction from there and needing surgery. So this is quite significant symptoms, and generally anemia can make one to have pica. So it's the anemia. It's not the sickle cell disease itself, it's the anemia that comes with sickle cell disease. So because of the sickle cell, they have to break down their blood cells very frequently. So they have what we call steady states. That's normal for them. Their hemoglobin is on the low side, but it's normal for them. So at times when the anemia is so severe, some of them can have pica. And at times it's so challenging to manage. Yeah. I'm not sure if there's any specific way you managed it, if you can share this, because I would really love to hear about this as well. Is very challenging to manage. But a medicine we also recommend is the next one I'm going to talk about quickly because I'm conscious of the time, is this medicine, hydroxycarbamide. So this is hydroxycarbamide is a disease-modifying treatment for sickle cell disease. So there was this clinical trial that was done in the United States, and it was done on this age group, 9 months. So they gave the medicine to ages 9 to 18 months, and this was what they found. So hydroxycarbamide has been around a long time in the United States before it came to the United Kingdom. So in the United States, they found the benefit of this medicine that once a child is 9 months old, they start hydroxycarbamide. But in the UK, sorry?
We're still looking at the old slide. Are you changing a new slide?
Okay, sorry.
Wait.
Did you see the new slide?
No, we didn't. That's.
Did you see this slide? Are you seeing this now?
Stop sharing. Stop sharing now.
Okay, so I'll just quickly share. Can you see this now?
coming up. Yeah, we can see now.
Yeah, so this was a clinical trial, age 9 to 18 months.
Yeah.
So they saw the benefits of the hydroxycarbamide, and in the United States, they started giving hydroxycarbamide to children even before their first birthday. They stopped the trial. The benefit was too obvious. And so, but at that time, they started using it in the United States. In the UK, they were still using criteria to give it. It was expensive. So they were only given to those that had severe symptoms or in all those criteria-based management. But now in the UK, they've changed from criteria-based management to give it to everybody because the benefit is so massive and is actually is expensive, but is cheaper on the long run because of the complications it prevents in sickle cell disease. And I'll just show you what has happened. So this was what happened in the trial. And this was some of the things they found, that hemoglobin improves. So this is, so this is a hydroxycarbamide. Those that were taking hydroxycarbamide, what happened to their hemoglobin? And those that they gave placebo. So it increases hemoglobin. So I found that when I give some of my patients hydroxycarbamide, it's also improved their PK because naturally their hemoglobin also improves. And it improves the MCV. So their hemoglobin is generally better, so MCV improves. MCV when it's low is a sign of maybe low iron deficiency and things like that. It improves their hemoglobin F. This is the fetal hemoglobin. So the aim of this medicine is to increase the fetal hemoglobin. So the fetal hemoglobin is the hemoglobin that newborns have. When a newborn is born, they have almost all their hemoglobin is HbF, F for Freddy, F for friend. So when they wean, so by the age of 6 months, the fetal hemoglobin starts going down. Is going to be replaced with the normal adult hemoglobin, or S will start going up. And at times, that's why the first time children have a presentation with sickle cell crisis is about that age 6 months of age. For those that are having, usually those that present early tend to have severe symptoms as well. They can have painful fingers, we call them dactylitis. So, but this hydroxycarbamide will start bringing back that HbF again. And so sickle cell will start going down automatically. And we've seen a lot of benefits in this in our children. At least 50% of the children I manage are on hydroxycarbamide, and they are doing very well. Okay. Platelets, it also helps to reduce the platelets because they tend to have high platelets in sickle cell because of other things that are happening. Inflammatory markers are going up. So it helps to put that under control, and it improves their neutrophils, because their neutrophils are usually high. So usually when you say their neutrophils is high, you're thinking, do you have infection? But they are well, no fever, but neutrophils are high. So it helps to put this in check. The reticulocytes are usually very high. It puts this in check. And these are the other benefits. And acute chest, you can see hydroxycarbamide and not on hydroxycarbamide. Pain, hydroxycarbamide and not on hydroxycarbamide. So those during that study, this was what they found. Those that were on hydroxycarbamide had less admission, less pain, less acute chest. They had less dactylitis. So dactylitis is what I described. They have painful fingers, usually in the first year of life. They can present with what we call dactylitis with painful. So you can see those on hydroxycarbamide, less of them had it than placebo. And transfusion, less needed blood transfusion than placebo when they're on hydroxycarbamide. And our own figures, very good figures, they're not ready, but I call it a wonder medicine. And we could see, I've got evidence of my patients that were on hydroxycarbamide. I looked at their admissions before hydroxycarbamide. Some of them were having 10 admissions a year. And you start hydroxycarbamide to 0 admission after hydroxycarbamide, or maybe 1 or 2 admissions with less duration of stay in the hospital. So it's truly a good medicine. So, but people wonder, what is the problem with the hydroxycarbamide? At times, people don't want to go on it, and they say most of the side effects are reversible side effects, because when they have exaggerated response to the treatment, and we do stop it for some time, maybe for 2 weeks, and we put them back on it, and the symptoms regress, whatever side effect regress, and then we put them back on it, and now they start tolerating it better, or we can reduce the dose a little bit. Some people are worried that hydroxycarbamide may be causing infertility, but they have looked at this. They have looked at those on hydroxycarbamide. They've looked at 40 adult men on hydroxycarbamide that have fathered children. And they have also looked at women who have used hydroxycarbamide. So what we just tell families to do is when they want to have a baby or they're planning a family, they let their doctor know so that they can stop their hydroxycarbamide for that period. And then after having their baby, they start their hydroxycarbamide again, because we don't know how it may be toxic to the baby. But interestingly, there was a particular, in fact, in my hospital, I was told about a particular patient who refused to stop hydroxycarbamide because when they stopped it previously, the symptoms in pregnancy was severe, and had used hydroxycarbamide throughout the pregnancy, and the baby was fine. But this is not what we encourage, because we don't know what toxicity it may have on the baby. We don't know, because baby is still a baby. We don't know if there may be long-term or side effect that may show up later in life. But currently, based on what we know, hydroxycarbamide has been available for a few years, and the benefit outweighs the risk currently. The risk of infertility, from what we know, is less. So what we do also is, some people that are really worried about this infertility, they do what we do, sperm banking for men. I think it's more of the men that are worried about hydroxycarbamide use. So it may affect the production of the sperm. So they do what we call sperm banking. But for those that have not even done the sperm banking, they have evidence that they have fathered children. The other thing I would like to say is that sickle cell disease that is not well managed itself can cause infertility. So when someone that has severe symptoms of sickle cell disease is not having a child, it's not necessarily because of any medicine, because some people don't have, they're having infertility and they are not on hydroxycarbamide. So the sickle cell disease itself can cause infertility if it's not well managed. As I mentioned about one of the side effects with priapism in men. If that is not controlled, it can cause infertility.
Okay, thank you.
It's an emergency management of priapism. I'll just stop there because I know there's a lot that people want to contribute. I'll just be here for any further questions.
Thank you very much, Doctor. Thank you very much. I think, so those are the medication. Like we see anybody, most people that are sickle cell will be on this hydroxycarbamide. Hydroxycarbamide, whatever it is. So now I think I've got Adebola, you got your hands up. Yeah,
Assalamu alaikum. I have more or less a two-part question, but pretty short. Okay. First one is concerning the role of malaria. There's this thing that I've heard that, and I've read as well, that people who have a sickle cell condition are not, they don't catch malaria the way the rest of us do. I wonder if this is based on fact, and maybe there's a particular aspect of the illness at the time that stops malaria from taking hold of them. The second one is, following on from that malaria thing, I posted in the comments, so I won't go into the long details, you can read it off there. But my point is, malaria DNA in my blood, which they found, as a result of the recent drive, they refused to use the blood they took off of me, apparently. Now, to me, this is a barrier to treatment. You want Black people to come forward and give blood, and yet you're telling us that you found an inevitability. If you've ever lived in Africa and had malaria, perhaps that's why this DNA ended up in my blood, because I certainly don't feel like I have malaria on a daily basis. I haven't felt it for years. So is this a real issue for somebody who needs a blood donation when they're in the throes of the illness? Is it also going forward an issue when it comes to things like, what do we call that thing where you puncture the bones, a bone marrow transplant? Are you ruling out a significant proportion of donors by having such barriers, which may be based on ignorance of how malaria actually affects people or is transmitted? So question, I guess, for the doctor.
Yeah, that's a very good question, and just maybe this may make you feel better. I did a blood donation, and then it was screened, and I think I've mentioned it. They said there was traces of malaria, and as a result, I shouldn't give blood again. So on one hand, you are encouraging people to give blood, and on the other hand, you are saying that unless it's 100% pure, you understand, you're not going to take the blood from them. So, Doctor, are you got any response to Adebola's questions?
Yes, thank you. I'll give a quick response. I would need to leave after. So the quick response is that it's a myth. Actually, people with sickle cell disease can still have malaria infection. And when people are traveling from here to Nigeria, we ask them to be on anti-malaria prophylaxis. They can have severe malaria. But you are right. I think generally those with sickle cell disease are more protected, but it doesn't mean they cannot have severe malaria. So we ask them to be on prophylaxis. And then something else about, hello?
Can I come in?
Yes, please.
Use paludrin, Sunday. That's why you see sickle cell in Nigeria, they don't have that crisis, malaria crisis, of the Sunday medicine, paludrin.
Yeah, so they should protect themselves from having severe malaria.
What about the one on the blood screening? If you donate,
yes, blood? I think generally, if you've traveled out of the UK, so if you're a frequent traveler, you will always have malaria parasite. If you go twice a year to Nigeria, you are likely to have malaria parasite and will not be able to donate. Yeah.
Okay. Is it a good idea? Is it really a good idea to eliminate such people from donating blood? Well, you can. Well, it's tricky because remember, some people have also never traveled out. We have children in this country that have never traveled, or adults that have never gone to a malarial zone. So you shouldn't move from one problem to another problem. So like any other infectious disease, they will screen for other infectious disease as well. It's not only malaria. They will just make sure they're also screening for HIV, hepatitis, and they would not knowingly give a blood that has an infectious disease to somebody. I think.
Sorry, in this case, it wasn't the disease. They
found
the
antigen.
DNA. I haven't been in Nigeria for 5 years at least.
Okay, the DNA. I'm not. Do you know? I'm not. I don't think I have that answer. I don't have the knowledge to talk about that. So if you've not gone to Nigeria for 5 years and they saw the DNA, I'm not sure of the answer to that.
But I did say in my case, they said it's the antigen that they're saying.
Antigen means malaria. Antigen means they found malaria in you. Okay. Yeah.
Okay. And we can.
So that means that it's just not full blown,
What I remember, because this happened to someone who also gave blood. From what I remember in the letter, it said that basically, if you've had malaria before, it's unlikely that your blood will be pure enough to donate. I mean, I don't have an answer for what Uncle's question is, but I think it is definitely something that is a bit harder for us because we are Africans, Nigerians who predominantly have the disease, and most people would have had malaria, which then is like a catch-22 in terms of donating blood. But I don't really know how we get over it.
It's difficult because the blood goes to a pool. All the bloods that are donated go to a central place. And at the time they are dishing out this blood, they won't be asking, is this one for sickle cell? Except we want them to now start reserving certain blood for only sickle cell patients because they are likely to be living or to have lived in a malarial zone. It's very complex. I think they may be able to do it, but I think it would be easier to just not think about malaria and just give any blood to whoever needs it than needing to screen again to say, okay, these bloods can go to this and this can go to that. It's more complex than that. I think the most important thing is we need to contribute to this pool of blood because.
Yeah, go on,
hello.
Doctor.
Yeah, we need to contribute to this pool of blood because at times, this blood is not, the blood are rare. At times, people with blood transfusion develop rare antibodies, and at times it's so difficult to even find a blood that matches theirs. At times, they may have to go as far as traveling to other countries to get the blood for them. Yeah. Okay. Thank you. Yeah.
Thank you very much. Thank you for your contribution. Okay. Yeah. Okay, now I remember something that I wanted to say before. This is I know that some hospitals do it. Yeah, the thing is that even in this country, there are some hospitals that are very good and knowledgeable with sickle cell. So you need to know those hospitals. Some hospitals in this country have no idea. when you come in, what they need to administer, understand. So you have to be forceful to tell them that, look, this is what's wrong with you, and this is the treatment. So there's a treatment card that you should be taking around with you wherever you go. That treatment card tells them in steps when you're having crisis, what they need to do and what drugs they need to administer. For example, you go to Saudi Arabia, even it could be in Nigeria. So if you take those, the sickle cell warriors know what I'm talking about. But take it with you so you don't have to keep explaining yourself. So that tells the doctors, look, this is what you need to administer. Understand? And then they will. But if you are telling them, it's like you are telling them their job. But if you have that, they know, look, this is from a certified doctor, and they will follow that. So because they know that, look, some areas they have no clue what it is. If you're asking them to give you morphine, they're like, what are you asking for morphine for? Are you joking or what? But if they are aware that, look, this is listed in your treatment, see? So that is very, very important. Secondly, your blood type matters as well. Those information should be at your fingertips. My father has a GP, a practitioner, and he had a swell on his chin, and he needed blood. And you wouldn't believe his doctor for over 20 years didn't know his blood group. He sent him to go and test. And I'm like, how can you be his doctor for 20 good years? And he said it's something they don't keep. So for me, all those medical information, understand, if you are traveling out, everybody, all those information, you need to have it with you wherever you are going, please. Okay, I think we will want to, now before we round up, Brother Ismail.
Yeah, and people like you, let's encourage our children. For the adults, is taking that if you are in Nigeria, in probably 80 to 90%, you're not able to take your job because of that. But what I found is our children are able to. So our team was able to argue this. And so let's encourage our children to get into
blood. Yeah.
Even if we can't.
Yeah, most of our generation, they would find one thing or the other wrong with the blood.
So let's encourage minding them.
Okay. Aya Shams, and then okay, she's giving it to her husband. Okay. Okay, this will now.
Okay, so what I'll do is thank you for the information I will share. I have somebody who is very, very close to me. I said it's so silence.
No, you are not done yet. Okay, maybe you have to come closer.
Are you muted then?
Yeah, I'm mute, so it's speaking. Okay, come here then.
So I have someone who's very close to me who has sadly lost a lot of her children in adulthood. So we also must think about this. He said, those who know, Allah tells us in the Quran that those who do not know should ask those who know. That's directly from Allah subhanahu wa ta'ala. Yes, people's children who do not have sickle cell die. But if we know that these are the implications, everything that we have shared today, it's an awareness for me, but it also gives me very deep sadness. And we need to be, alhamdulillah, we are Muslims, and we have been told that knowledge is from cradle to death. And knowledge is the lost property of all Muslims. Wherever you find it, they are picking. So we can no longer say, in this country, ignorance is not an excuse. So we must take that out of our lives. We don't want to be ignorant anymore. Once we have the knowledge, we must use it. So today, that lady I'm talking about, a mentor to me, she wonders if she brought this on herself. She wonders whether Allah has decreed that she will not have a child who will be Sadaqah to the area for her because of those decisions. The youngest that is at 47. So I want us to be aware of this. Above all, I want us to pray for everybody who is a warrior. May Allah subhanahu wa ta'ala, as we agree that this is a test from Allah subhanahu wa ta'ala, that Allah subhanahu wa ta'ala should hold all the parents firm. That Allah should hold you firm, you the warriors. And that Allah is the one that grants ease. And Allah should grant you ease. When and not be Ibrahim alayhi salatu wa salam, was thrown into the fire. The fire did not burn him. Allah did not let that fire burn. Fire burns, but fire did not burn him. Allah can make your pain painless. So ask Allah for what you want. When our mother Asiya, the wife of Pharaoh, was being skinned, wallahi, she didn't feel pain because Allah took that pain away. So you don't have to feel pain 24 hours of the day. You don't have to feel pain every day. You don't have to feel pain every moment. Allah can take the pain away. Because Ọlọ́run ọba tí ò kì í sùn ni, tí ò kì í rẹ̀ ni, kò dẹ̀ sí àṣetì fún Ọlọ́run ọba. May Allah subhanahu wa ta'ala help us in our ways. May Allah help us to be instruments and tools that will contribute to this awareness. And if eradication is in our hands, may Allah subhanahu wa ta'ala help us to be those who will contribute to the eradication of this disease and many more. Because Allah has told us that there's no disease without a cure. And we must believe in that firmly, and as we begin to research into it. Bismillahirrahmanirrahim. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله. Let's do Allah for all those who have died. Bismillahirrahmanirrahim. Huwa Allahu ahad, Allahu samad, lam yalid wa lam yulad wa lam yakul.
Okay, I think we will bring it to a close now, but what did you say? Yeah, I think marriage.
Yeah, so we were just closing off with the fear of sickle cell people. I think we spoke a lot about preventing sickle cell children from coming into the world, where we can do those preventions. But just to quickly brush upon sickle cells who are already in the world, which one of those struggles are marriage. I think for us, the younger generation, I mean, I don't want to speak on behalf of anyone else, but I think in terms of the awareness we're trying to bring about of it now, it is something that we're more open to speaking about. But I think in terms of our parents, it's something that we would like them to speak about more or understand more, and that is the prevention of marrying, AA and SS. AS and SS is not advisable at all. That's like 75% chance. But AA and SS, which will always result in an AS child. But the prevention of an AA marrying an SS because of fear, I think is quite
it's confounded, really.
Yeah, and I think it stops marriages from happening for no reason, because like Dr. said, AS carriers, they don't suffer. So that's not something that you should be fearful of marrying a sickle person, because there will be a burden of now having to look after this person with sickle cell. But it wouldn't affect the children.
I think alhamdulillah, that's a good note too.
One more note, please. SS lives up to 70 something. So more than that. So well managed, like Doctor said, you can live, because those without SS, they die young. So SS can live. So don't let the brothers, they shouldn't be fearful of SS to marry them. So they can marry AA. Please, AS and AS is no way. No way. We should stop it from our children. AS and AS. No way. We should ask.
I think the permutation, if you have AS, SS, there's a high chance. AS, there's still a risk, to understand. But the best bet is AA, SS, AS. Understand, there wouldn't be an issue there. So what we're saying is that, look, those that are already born into the world, educate yourself. There's nothing wrong if a SS sees an AA and they are willing to marry. The parents shouldn't say, no. Understand? Because the SS that have got to the stage where a man or a woman see themselves as spending the rest of their life with, that means that that person probably doesn't have a severe condition, and then we shouldn't then prevent them from living their life. Understand? So it's all about education, education, education. And then may Allah, like we said, understand, even those that are being severely affected, may Allah ease it for them. It's not easy for anybody to go through this. Like you could see, Elijah, Farida, Farida wouldn't want to blindly walk into it again. So even if you are affected and you see it yourself, understand, you will know that, look, if this is the way to prevent it, let's prevent it and manage those ones that we've got, understand, that are having it, and then don't kind of isolate, understand, it's not infectious, understand, it's just that, look, you support those that have it. Okay, quickly, but Salami, before.
Alhamdulillah. Honestly, this is a very interesting topic. I've never been very, very aware of this issue until now. Alhamdulillah, I was not, I didn't have that knowledge when I entered into marriage. It didn't even cross my mind. In fact, when someone asked question, did you know your student? I just sat myself in that. So the issue now is, we say we have done the when I did in Nigeria, I just did it because out of curiosity, not that I had knowledge that different marriage of the. So the issue now is, what one, now that this, after this today, I'll go to my record and see whether I record, if I have one, I go and see what it is, but I want to go and do another one. So my problem is this. Another revelation that scares me is this, that when somebody mentioned that something was done in Nigeria, but when it can't, but that one was done in Nigeria, yes, but coming here it was a different thing. Yeah, and that is my fear. That there could be, it's not possible to have an element of error in that test. You want to do tests to know what's the genotype. Yeah. Is there no, that's kind of margin of error?
No, because you see, the thing is that it's not the only one. I can count almost about
that's
6.
I'm not doing the
I can count. There's no error here. Yeah. I've counted about 6. I've counted about 6 people. Yeah. I've counted about 6 people. I've counted about 6 people that got here confidently saying that they are AA. And then they realized that when they went to their GP and done the test, they are AS.
Okay, I'm trying to hear from the US, so
it's best for you to, that's why the doctor says it's best for you to go and redo it. Although I don't think you're part of the childbearing. You are past the childbearing age now. Okay. If there's any of the young sisters want to talk, I want to give you the opportunity before we round up. Yeah? Okay. Wa alaikum salam, my sister. Alhamdulillah.
Alhamdulillah. Sickle cell warrior, 40 years and counting. Alhamdulillah. I'm on, like he said, I'm on the less painful spectrum. So I know. And this is why I spoke to Farida about creating this awareness, and I'm glad it's well received. Jazakallah khairan to everyone. There's something I want to, in terms of just not educating ourselves, also the hospital staff. It's been horrible. If you go to hospitals, which is why Farida would never go to a hospital until she's almost dead. We are the strongest people we know. We don't tell you until you said about jaundice and all that. The way we know ourselves is through our eyes. We look at each other and we can tell straight away, you're a sickle cell person, you're a sickle cell person. And the treatment of us is just getting better. We've had a few people die, and because of that, laws have been changed. You go to the hospital, you tell the doctor you're in pain, they tell you to get up and walk and go to the toilet yourself. A cancer patient would never be treated that way. And our pain is way greater. I'm not discounting anybody's pain, but I can tell you our pain is greater than any cancer patient's pain because we get the same drug. There's another thing that affects us that makes us upset when we go to the hospital. It's because we're treated like drug addicts. There's only one thing that can cure us, that can make us better. It's morphine. And anyone that knows morphine, the components of it, is like cocaine.
So you're having cocaine every single time you go to the hospital. Some people will tell you when you come, oh, did you just come because of paracetamol? I came because I want to get better, not because I want the drug. I know everyone is saying, oh, if Allah has bestowed you, it's a painful journey that we keep going through. We keep trying to explain ourselves. 10 years ago, when I went to a hospital from work, I was in pain for 2 hours before I was given anything. So that's it. There's a lot of ignorance. There's a lot of misconception. There's a lot of, which is why we're bringing awareness, and we're trying to create it within ourselves. So if you know anybody in the hospital, tell them we're not drug addicts. We're not here. We're here to make ourselves better. Yes, thank God now the doctors are creating plans for us. So if you go, we're to be seen 30 minutes as soon as we come in, but in reality, it doesn't happen. We're to be given our treatments 30 minutes as soon as we come in, but in reality, it doesn't happen. We understand the NHS is under pressure we're in, but a sickle cell, if you see a sickle cell go to hospital, just know that they are on the verge of dying. They are not there because they just want paracetamol. We've taken all that at home. We've done our this. I carry a bottle of water everywhere you see me. We're affected by every weather. It's not just whether it's cold or hot. We're affected by everything. So we thank you all for the information. Please go and donate. Ask your children to donate. Help us in eradicating, preventing, or managing it. Jazakallah khairan.
I think I'll thank you very, very much for that. I think that the other thing I want to add to that, when I talk about hospitals, King's College Hospital, we live in Croydon. Farida will not go to Croydon. She will go to King's College. King's College have even tell their own sickle cell warrior, don't go to A&E. They have a special A&E for sickle clinic for them. So you walk in, you are seen straight away. If you need blood, they will give you blood there. If you need to be tested, yeah, King's College.
St. Thomas's.
St. Thomas's as well. They have the department. Don't go and sit in A&E for 4 hours. Come in, understand, and they will treat you. They have beds, understand.
I think you have.
But the only thing is that it's from 8 to 5 p.m. Understand? To 5 p.m. 8 in the morning. Okay. Yeah, but if you after those hours you go to A&E, but the fact that that is available for you, you also think that you are experiencing pain, you want to get there before they're closed. And if they need to admit you, they will admit you to the ward. Understand? Yes. So that's why I was saying, know the hospitals to go to, even if you have to travel a distance. Understand? Because you want to go to where you will be treated for the illness rather than having to be explaining to people how to treat you. Okay.
Not all.
I'm sorry, Shamsuddin, I'm coming.
Because some people are not from, some people it's not nothing.
Yes, my friend, she does tramadol because she's allergic to morphine.
Yeah. Okay, Shamsuddin.
Can you mute that one? Bismillahirrahmanirrahim. So we have heard today and we have listened to ourselves. It has been an emotional thing for all of us. While at this program today, I think I've shared tears once or twice already. A sister put it there that this is so emotional for her. She has a heavy heart. And I can imagine what many people would have felt going through this today. I just would like to say that for those who are not in it, for those who are not in it, please take your precaution and let's do what Elijah said we should do. AA to marry AS and AA to marry SS. This should be fundamental for us. If you don't know about something, it's an excuse. But once we start knowing, we should make effort. If you still decide that love is more important to you than choosing than the AASS thing, please just bear in mind that you are the one determining the sort of qadar that is coming your way. But Allah is a merciful God. Allah is so merciful for us that even if
you chose to marry SS person, or you didn't even know, but you are in it and you have a SS child, or yourself, you are going through this. I just would like to tell you that Allah has chosen you, and Allah will not make your pain go to waste. Think about it. A woman suffered from epilepsy during the time of the Prophet. And whenever she suffered this epilepsy, you know, things happened, she rose on the floor and all that. And the Prophet said, can I make dua for you so that this thing will go away? She said, no. Why? Because she knows that Allah rewards her for that pain, for those episodes. She's just said, can you make dua that when I'm suffering it, that I don't expose my body? And this is so important to us. There are 7 categories of people that are regarded as martyrs. 2 of them, one is someone who suffers from pain. Some will translate it as chest pain. Some will translate it as body pain. But we know it is internal pain, pain that you cannot see. The second is someone who dies from stomach upset, like stomach poisoning. So we know that there is hope for those who are going through this sickle cell sickness. In fact, every time you are in pain and you do your acts of ibadah, when it is said that you get up to 10 rewards, you perhaps will be getting in multiples of thousands. You don't know. But you can actually tell Allah, oh Allah, this pain I'm going through, please reward me for it. Don't let me suffer in pain. And Allah will definitely reward you for it. So somebody said, oh, which God? Pray to who? Where is this person that made me suffer from childhood till today? But no, my brothers and my sisters in pain, that Allah is giving you an opportunity to gather more rewards than scholars who spend years memorizing Quran and Hadith and teaching people. Your reward is probably greater than their rewards. So just stay with Allah. Know that Allah is giving you opportunity to enter Jannah, almost free of charge, we can say. But it's not free. The pain you go through is enough for Allah to use to compensate you for your life suffering. This world is a limited period.
Walaikum assalam wa rahmatullahi wa barakatuh. Okay, I think yeah, we've come to, I think we will call it a day now. Thank you everybody for joining. Thank you for contributing. And what I would say is that let's act on what we have received in terms of information from here. Sickle Cell Society, try and join. You don't have to be a warrior to join. You can be a carer, a parent, understand, join, and then we can then push for, look how long it took NHS to get onto this acroskamide. It was in the US for over 10 years before NHS took it on. And when they took it on, they were not ready to give it to everybody. But if you are joining institutions like this, these are the things you can push, understand, and your voice will be heard. And I will hand over now to Brother Ismail Babalala to give us the closing.